So it's 12 p.m. and I think we are good to start now. So, Dr. Mahmood, should we start?
Yeah. It's 12 p.m. We have to go ahead.
Yes. So hello everyone. I'm Manu Awasthi, a second-year doctoral student from the College of Public Health at ETSU and your moderator for the event today. I want to thank each and every one of you for being here and welcome you to the launch of the Center for Cardiovascular Risk Research. Without any delay, let's move on to the event, and here's our. So as you can see, the first thing on our list is the introduction. So let me begin by introducing our distinguished guests. So just a quick request, as I say your names, please wave your hand so that everyone in the audience can see who you are. So here we have Dr. Wolsey Bishop, the Senior Vice President for Academics and Interim Provost at ETSU. Thank you for being here, Dr. Bishop. We have Dr. William Duncan, the Vice Provost for Research at ETSU. Thank you for being here, Dr. Duncan. So yes, everyone else here on is from the team, so you all will be introducing yourself later when you are presenting. So let me start sharing my screen again. We are going to start with a short comment from Dr. Bishop, Dr. Duncan, Dr. Wyckoff, and Mr. Gregory. So Dr. Bishop, if you could please go ahead and say a few words about the team and the center overall.
Well, welcome to this exciting event today. I know that this has been a passion for Dr. Mahmood for a number of years now, and it's really exciting to see his dreams come to fruition. And it's exciting to know that he has drawn together a strong cross-disciplinary team of faculty from across the university who will be working together in this research center. This center aligns so strongly with the mission of ETSU and that mission to improve the lives of the people of this region. We know that people in our region have a disproportionately high rate of cardiovascular disease. And the fact that we will have faculty and students and faculty mentoring students in this center to find causes, to find better ways of treating, to look at this from a population perspective is so significant and important to our region. I believe this center is going to provide opportunities for interprofessional training, for interprofessional collaboration and research. And I believe that working together, we're going to see an improvement in the cardiovascular health care of the people of our region. Thank you very much for inviting me to be part of this today.
Thank you, Dr. Bishop. Dr. Duncan, if you could please go next.
Yes, thank you. And I'm excited to be here. I've worked very many years since I've been here with Dr. Mahmood, who is actually one of my first grant writing classes that I gave here, and also with Dr. Paul. And I think this is an excellent center to be formed here. It really reflects the work that's gone on with Dr. Paul and Dr. Mahmood and others. Dating back to 2012, I remember getting a call from his chair, Dr. Mahmood's chair, and saying, Dr. Mahmood is interested in finding a collaboration in cardiovascular disease. And I believe I suggested maybe you should contact Dr. Paul. And this is sort of the fruition of what's grown out of that I've seen this collaboration grow, bringing in others across campus. I began with work at Wellmont when there was a Wellmont, and trying to get everything in place to allow us to have a relationship there. That's now grown into a very strong working relationship with Ballad, with Dr. Lowe's and Dr. Metzger. A lot of opportunities to improve cardiovascular research and improve disease outcomes in our region. And this has also moved down to collaborations with UT Health Science Center in Memphis as an AHRQ award. That's also going to continue to reap benefits as supporting the Tennessee Heart Health Network. So I just think this is exciting. It's the kind of center that we need to see at ETSU that really brings people together, interdisciplinary researchers across campus. It also allows us to work more effectively and collaborate with Ballad and access to the research activities they have there and the databases they have in terms of cardiovascular interventions. And also, as importantly, it will also allow our researchers to be more competitive when they apply for NIH, AHRQ, and PCORI awards. So it really, I'm just so excited. I like to follow up with what Dr. Bishop says. The outcomes of this development of this center will be very important for improving disease outcomes in the region, but also increasing our research productivity and ability to recruit additional faculty to the university. So happy to be part of this. Thank you for inviting me.
Thank you so much for your wonderful words, Dr. Duncan. So I can see Dr. Randy Wyckoff, the Dean of College of Public Health, has joined us here. So Dr. Wyckoff, if you could please say a few words about the team and the center overall.
Sure. Well, thank you very much for inviting me. Let me apologize. There were several of us on a different site waiting for this to start. So I missed the beginning. I missed Dr. Bishop's opening comments, and I apologize for that. But I know I share everyone's enthusiasm for this center. Over the years, ETSU from its inception has been committed to improving the health and well-being of the people of this region. And while we talk a lot about that being education and economic development, we also recognize that research is an important part of that. Research is directly relevant to education and economic development, but it's important on its own right. And if you look at the kind of research we've been doing, it's always focused on the needs of the people of this region. So whether it's the Addiction Science Center, rural health, women's health. But the number one health challenge that we face, of course, is heart disease, right? It's the leading cause of death around the world. It's the leading cause of death in the United States. It's the leading cause of death in Tennessee. It's the leading cause of death in Appalachia. And we really, if we're going to be successful at improving health, we have to address that. So I applaud Dr. Mahmoudou and his interprofessional colleagues for putting this center together. I appreciate the support from Dr. Bishop, Dr. Duncan, and so many other people in the leadership of this university that has made this possible. And I'm honored that our college is part of this significant and timely advance. So Dr. Mahmoudou, thank you. And Manuel, I'll turn it back to you.
Thank you, Dr. Wyckoff. So I'm waiting for Mr. Gregory, but he's not here yet. So let's move ahead with our with the next thing on our agenda. So thank you everyone for your wonderful comments. All of your support and leadership really means a lot and adds value to the center, the College of Public Health, and the university overall. So moving on, let's acknowledge the two minds who are actually responsible for making this center from a dream to a reality. Please let's welcome Dr. Hadi Mahmoudou from the College of Public Health and Dr. Timir Paul from Quillen College of Medicine, the two co-directors of the center. So Dr. Mahmoudou and Dr. Paul will be doing a short presentation and showing us their work in the region and talk about the center. The screen is all yours, Dr. Mahmoudou and Dr. Paul.
Yeah, Dr. Paul, we are not hearing you. You are on mute. Timmy, we are not hearing you.
Can you hear me now?
Yeah.
Yeah. Can you see the slides?
Yes.
Let me. You can see the slides in one screen or two screens. Sorry.
We're seeing both screens.
Both screens. Okay. Let me.
There we
What
go.
about now? One screen?
Yeah.
Okay.
Yes.
This is Timmy Paul. Good afternoon. I want to thank you all for your time and participation in this event. We've been waiting for this event for a long time. We started this process in January 2019. We had an initial team that includes Dr. Hadi Mahmoodou, myself, David Stewart, and Amy Poole. After multiple application process and multiple meetings, finally we got our center approved by TSU and Tennessee Higher Education Council in 2020 August, and here we are now. I would like to thank you, my team that I just mentioned the names, and also a special thanks to Dr. Hadi Mahmoodou. Without him, the center would not be here today. Because of his initiation and persistence, we are here today. In next few slides, we'll show you why we started this process, how we started, who is our collaborators, and what we've been doing now. And then Dr. Hadi Mahmoodou will discuss our core values, core goals for our center. So we've been doing this cardiovascular research for a couple of years. Currently, we expanded our research to COVID-19 too. We submitted 2 manuscripts, and we also have accepted presentations for national presentation that's coming up. Initially, when I joined at ETSU in 2012, Dr. Hadi Mahmoodou was looking for effective partner, collaborative partner. So Dr. Kauri and Dr. Ranjan Chakraborty from College of Public Health talked each other, and they suggested Hadi to talk to me. So Hadi contacted me, we met in our office. We found that we have a common goal and common interest in research. So we said, okay, let's start this collaborative work. Then within few months, we met with Wellmont CBA Heart Institute with the leaderships, Dr. Jerry Blackwell and Tim Ottoberry, the CEO of that time. They are very supportive from the beginning, and they gave us the database and all other supports. With the database, we had a good database on coronary artery calcification, and we looked for the subclinical atherosclerosis and cardiovascular outcomes so far, and we published many abstracts and manuscripts. Then we expanded our collaboration to College of Public Pharmacy. We included Dr. David Stewart from College of Pharmacy. These are our current partners. Of course, the Ballard Health, Legacy Wellmont, and Legacy Mount Eastern Health Alliance, Mandate Heart, Tennessee Department of Health. Currently, we started collaborating with UT Memphis, and we got a large grant collaborating with them, Caring Hearts, and so forth, as you can see here. Ballard Health remains our key partner for clinical and public health research. Initially, although Wellmont was our initial partner, we expanded our collaboration with Mountain State Health Alliance. Now we've been collaboratively and closely working with Ballard Health, directed by Dr. Mejgar, who is the research director for them. Ballard is also participating in our current projects named Tennessee Heart Health Network Research Project that we got a large grant with UT Memphis. We thank all of our collaborative partners for their continued support and participation in our research, and a special thanks to Ballard Health research team. We received several grants, RDC from ETSU, we received PCORI grant, and currently we received Agency for Healthcare Research and Quality. It's a $4.4 million grant, and we are subcontracted, and we are the co-investigators ETSU. At ETSU. This is our original research team. We named that CVD Appalachia team or CVD Appalachia research team. We got $250K grant named PCORI grant. We successfully completed 2 conferences, one in 2018 and another one is 2019. We had participation from 7 states and more than 400 participants in each conferences. We are also very productive in our research. As you can see, we slowly grow, and we continually have been growing. In our overall manuscripts, we have many publications in Appalachian region area. We also had many presentations from our research team nationally and regionally. This is our current organizational chart. We already have an existing advisory board. We'll just need to refine and redefine. We had an advisory board for our Appalachian CVD group. Dr. Mahdi Mahmoodi and myself will serve as co-director. I'm happy that from each college, one of the faculty has agreed to serve as the associate director. And we'll have a center coordinator, hopefully it will be full-time, who will coordinate with project or grant coordinator and contact administrator between associate directors and also other program facilitator like outreach program and everything. I thank you for your attention, and now Dr. Hadi Mahmood will continue the rest of the talk.
Okay, thank you for the presentation. Can you stop sharing, Dr. Paul, so that I'll start sharing my screen? Okay. Thank you, everybody, for coming to today's opening ceremony. And again, as Dr. Paul has just pointed out, our work may not have begun if not because Dr. Chakraborty and Dr. Corey reached out to Dr. Duncan to explore the possibility of a collaboration between researchers in the College of Public Health and College of Medicine. So based upon, building upon what Dr. Paul has said, we came together, and this idea of a center started all with this Appalachian, CVD Appalachia team that you saw earlier. And we thought we could transition our work in the region into an institution, and that has brought us to this point today. So the goal that we originally established, our mission was to mitigate cardiovascular burden in this region, and of course address issues of health disparities and promote education and policies that will mitigate this burden in this region. Our mission is to, of course, reduce and eliminate cardiovascular diseases in this region that aligns perfectly with Healthy People 2020 and Healthy People Territory. And associated risk factors like tobacco use, that's my major research area, and other risk factors. While again addressing issues of health disparities and healthcare inequities in this region. We have developed 4 key strategic goals, and our first one is to improve the quality of life of residents of this region, Central Appalachian region, through health education, identified areas of disparities and inequities in cardiovascular health outcomes and risks that can be addressed, and of course, provide opportunities for interdisciplinary research and training. And that's been my passion in terms of building any kind of center in ETSU, that the center should be a venue for training people in research, and as we may know in the coming slides. So the cardiovascular, the Center for Cardiovascular Risk Research, which is, we abbreviate it as CCRR, we have 4 core goals. The first one is research, which we've been doing over the past years since 2012 and 2013, and scale those up and deepen it and maybe strengthen the research that we are doing. And of course, mentoring, and we have been mentoring from day one. We have engaged students in our work, not only students, but also faculty and even some fellows in our work. We have also been engaging in issues around programming, and the CVD Appalachia is a typical example of where we engage the community in kind of programs that will enhance or promote cardiovascular health in the region. And the last aspect is community engagement. And our goal is to be able to engage the community around us, not only as just research participant, but as also collaborators. And we already have pilot work around where we have been successful in engaging and training community members as researchers and as team members. So these are our research areas, and these research areas emanated from the work that we did for CVD Appalachia, which was to set up a cardiovascular research agenda for the region. And so one of the areas that we intend to look at is, of course, cardiovascular diseases, the type of cardiovascular disease, the risk, and managing those populations with different types of cardiovascular diseases. Medication adherence is part of our thinking, and our main, also from public health perspective, is to try to understand how social determinants impact health outcomes and risk and patient care in terms of improving patient-centered care in the region. Culture is part of cardiovascular health that we cannot ignore, especially in this region. So we are also interested in that. And as part of our work, we are engaging people in different methodological approaches. And the last segment or the last aspect is engagement approaches. So how do we get not just our colleagues across disciplines, but also the community involved in the cardiovascular health? And as Dr. Paul said, of course, today the big elephant in the room is COVID-19. So we are also interested in how COVID-19 impacts population with chronic diseases. We focus on cardiovascular health. Mentoring is as part of us, so we keep on increasing our work around issues of training new researchers, both students, fellows, residents, and community members, and engaging in stakeholder partnership. The research, again, here is the programming aspect. We are also interested in developing kind of interventions, either through some form of public health interventions in both clinical and public health collaboration and in community-based settings and programs and education. The Tennessee Heart Health is a typical example of interdisciplinary, cross-disciplinary collaboration between the UT Health Sciences and others. And so these are our key partners. So we are East Tennessee State, we have Valley Health, UT Health Sciences, Nashville. At Memphis, we have University of Memphis, we have QSOS, and many other health systems as collaborators. We are using the PCORI community engagement model to be able to involve our partners or stakeholders in our projects from the conception phase to the presentation phase. And we've demonstrated that with at least 3 manuscripts. One has already been published in the American Journal of Medical Sciences that brought all our groups, including community members, to publish that paper. And we have currently have one under review in American Journal of Preventive Medicine. So this is our future outlook. The future outlook is to scale up what we have been doing over the past years through this institution that we are building through the cardiovascular health and to develop extramural funded research. These are, so far, again, we began with a small team, and much of our work has depended on few people donating countless and countless of hours for free. And so I have to acknowledge our 2 coordinators who have been helping us, which is Amy Poole and Cynthia Blair, and they are actual community members. They reside our community members, and they serve as liaison between the center and the community as a whole. Then we have a lot of graduate research assistants through the help of our own colleges, individual colleges and departments, including my own department, Health Services Management and Policy, with the support of my health head of department, Dr. Corey. And we have a lot of research volunteers as well. So thank you everybody for donating your time and dedicating your time to today's presentation, and for being here to help us open this center that was approved by ETSU and Tennessee Higher Education Commission, which is TEC in last fall. Thank you very much. So Mano, you can take over from here.
Okay, thank you, Dr. and Dr. Paul, for the wonderful presentation and everything you're doing to improve population health in the region and the nation overall. Now that we have heard from the co-directors, let's hear from our associate directors and the affiliated faculty of the center. So please let me share my screen. And so here's a list of the associate directors and the faculty of the center. So Dr. Krishna Singh, please go ahead and say a few words about your work and the center.
Hello, everyone. I am Krishna Singh. Can you hear me?
Yes.
I am Krishna Singh from the Department of Biomedical Sciences at Quillen College of Medicine. I have a joint appointment with the Quillen VA Medical Center. The main focus of my lab is to investigate the cellular and molecular basis of heart failure. Just to briefly summarize, research in my lab has identified 3 candidate proteins with the potential to modulate heart function. Our studies were the first to show that increased expression of a protein called osteopontin in the heart coincides with the development of heart failure. Furthermore, deficiency of this protein associates with decreased heart function following heart attack. We have also shown that ubiquitin protein, when given from outside, has the potential to rescue the heart muscle cells from dying while improving heart function in animal models. The third candidate protein we have identified is called ATM. Our studies have shown that deficiency of ATM associates with increased cell death in the heart during heart disease. Currently, we are exploring how these proteins modulate heart function during heart disease. Formation of the new center CCRR will definitely provide us with new collaborative opportunities to understand heart disease in our region. I am thankful to Dr. Bishop, Dr. Noland, Dr. Duncan for supporting the creation of this center, and to Dr. Mahmouda and Dr. Paul for doing all the groundwork. I am looking forward to working with all of my colleagues and establishing new collaborative opportunities. Thank you.
Thank you, Dr. Singh. Dr. Stewart, please go next and say a few words.
All right. Well, thank you, Manuel. For everyone else, my name is David Stewart. I'm a professor, vice chair of the Department of Pharmacy Practice in the College of Pharmacy, and I received my Doctor of Pharmacy degree from Campbell University. The only reason I point that out is because when I attended ETSU as an undergraduate, I didn't have the opportunity to attend pharmacy school here at ETSU, and I'm excited to be back here. I've been on the faculty for the last 14 years, and I've been really fortunate to be a part of this team upon invitation by Dr. Mahmoudu and Dr. Paul several years ago now. It's really been exciting to build upon some of the foundational work that they've already laid. As a native of the region of Northeast Tennessee, when we talk about improving the quality of life for the people of this region, that really resonates with me, and it's exciting for me. I recognize the value that has, and I've been able to firsthand see the impact of that, not just on patients, but also with friends and family. So, I've seen firsthand the implications that cardiovascular disease can have. And I see the disparities. I saw those, growing up in the region, and still see that in the patients that we serve. And so I'm really excited to help continue the work that Dr. Mahmoudu and Dr. Paul have began, and to expand that with this robust interprofessional team. They've put together a great team with an outstanding mix of talents. And this center really represents an outstanding opportunity to allow not only these researchers, but also the faculty and students from all of ETSU Health. And specifically, I'm excited for the opportunities that this will allow for the faculty and students within the College of Pharmacy to be able to give back to the people of the region who've been such strong supporters of not just ETSU, but specifically of the College of Pharmacy when it was founded. As a clinical pharmacist, there's just so many opportunities out there that we have to improve health through the use of evidence-based medication therapy. And one of the things I tell students often is that we can come up with the best plan in the world, but that plan is meaningless if it doesn't translate into a treatment that the patient receives and takes. So we can write a prescription. We can make sure that the best medication is prescribed, but if the patient doesn't have access to that, we don't get the outcomes that are intended. So I'm really optimistic that this group and the formation of the center is going to provide opportunities to bring some cutting edge science to this region. It's really going to improve the health and the well-being of the residents of Northeast Tennessee. So I'm both excited and thankful to be a part of this team. And I just want to extend my thanks along with others to Dr. Mahmoudou and Dr. Paul, but also, Dr. Duncan, Dr. Wyckoff, Dr. Bishop, your support, the support from all the levels of the universities as we've worked through this process. So I'm excited to be where we're at today. And again, just want to extend my thanks to those who've made this a reality.
Thank you, Dr. Stewart. Thank you for your wonderful comment. Dr. Flo, you are next.
Well, thank you. I'm Dr. Florence Weyerabach, commonly known as Dr. Flo because people have difficulty with my last name, which is fine. Unlike some of the others, I'm not native to this area, nor did I receive my education, my formal education at ETSU. However, since I've been at ETSU, and it's been since August of 2010, I have learned so much about this region, and I've learned so much about the people of the region and how dedicated they are and how wonderful they are in embracing people that allow them to help them. And I'm fortunate to be one of those individuals. As a nurse, I have seen firsthand what happens with people with cardiovascular disease. As a nurse that is also educated in public health and being a public health nurse, I have a foot in both camps, both in nursing and in public health, and understand the importance of looking at how we can prevent illness and prevent disease, increase quality of life, but also how we can help people with rehabilitative services, such as the work that we're doing now with COVID, looking at what is the impact and how is that going to make a difference for people. And that's such an important area to look at, especially when you think about where people live and how people have access to healthcare and how people understand their healthcare. So I had the fortunate opportunity to meet Dr. Mahmoudou, I guess about 3 years ago now, and he was really excited. He came to my office and we chatted, and he put me in on a first opportunity with a Robert Woods Johnson grant, which I don't know that it went anywhere, but it started the relationship, which I'm so grateful for. I've been on a couple other activities with him, with Dr. Paul and with the center, and I've just see the opportunity for the center to soar and for nursing to have a voice at the table and to contribute what nursing brings to the table, not only in regards to our clinical care, but also in regards to our research capabilities. I look forward to having our students, both our PhD and our doctoral students, and potentially our undergraduate students, assist with some of the activities in the center. So thank you so much for having me and involving me with this wonderful opportunity.
Thank you, Dr. Flo. You are a great asset to the team. Now, Dr. Doling, please go next.
Good afternoon. I am Carrie Lynn Dowling McClay. I'm an assistant professor at the Bill Gatton College of Pharmacy, and want to extend my thanks for being invited today to speak. I am an affiliate faculty member of the center, and so I want to particularly focus on that opportunity and all of the great benefits that are coming from this affiliate faculty position with the center. So I am an early career academic. I have started my career at the Gatton College of Pharmacy as an assistant professor. And I want to extend a special thank you to my colleague, Dr. Stewart, who extended an invitation to join this group about a year and a half ago. And I have been very blessed to become a member of the team and experience wonderful networking and professional development out of being a member of this group. I'm not originally from this area as well, but have been able to blend my interests. Very grateful to have been a graduate of the MPH program from the College of Public Health here at ETSU, and could not have asked for a better opportunity to blend my pharmacy background with my colleagues in public health and across all of the other colleges at ETSU. And finally, just what we especially appreciate being members of this team, coming from the pharmacy perspective, is the opportunity to also bring our voices to the table and to for myself and Dr. Stewart to find ways to support our profession and our colleagues in making a difference in cardiovascular outcomes as part of the overall interdisciplinary picture in this region. So very excited for this center being formalized and all of the work to come in supporting pharmacists and community members and other professions in this region. So thank you very much, everyone.
Thank you, Dr. Doling. Dr. Ahuja, you're next.
Thank you, Manu. I'm Dr. Monique Ahuja, and I'm an assistant professor in the College of Public Health. I'm really excited about the public health impact this center is going to make, and not only for now, which is offering solutions to some of these problems. Some of the rates of cardiovascular disease are particularly high, as we know, 42% higher than the national rate in Central Appalachia, and 80 out of 82 counties in this region being higher than national rates. So as a public health professional and a public health faculty member, I cannot express my gratitude and excitement for making an impact and bringing these people together. That's not looking at the now, what can we solve in the near term, but the future, the mentoring of the next generation of cardiovascular risk researchers. This group has been involved so heavily in mentoring graduate students across multiple departments over the last several years. And that's the key, is also not only looking at, sure, we want to collaborate with our faculty and members, but bringing in the next generation of researchers across multiple disciplines who will make an impact. And with Dr. Mahmoud's leadership, he's not only formally but informally mentored multiple students to get involved with research, have him present, have him publish manuscripts. So the center is going to offer, opportunities for research, building infrastructure, and we have, many cardiovascular research opportunities in the region. But bringing everyone together and forming these collaborations and the infrastructure is going to be very essential moving forward into this region as we improve our health and continue to strive to improve these rates. So I'm thankful to Dr. Mahmoudou for his leadership, and also for Dr. Duncan, Dr. Wyckoff, Dr. Noland, and everybody else, and Dr. Bishop, who's made this possible. Thank you very much.
Thank you, Dr. Ahuja. Dr. Fletcher, please go next.
Hello, everyone. I'm delighted to join you today. I am assistant professor in Appalachian Studies and assistant director for the Center for Appalachian Studies and Services. I joined CCRR as a medical anthropologist with several years of research experience looking at health disparities in Appalachia. Thinking holistically as an anthropologist, I understand health does not simply exist as a biological phenomenon. Many factors influence health, disease, risk, morbidity, and mortality. These include social conditions, including social status, discrimination, stress, access to resources, and environmental exposures to pollutants. Rather than being a region apart or the other America, Appalachia serves as a mirror for the nation, allowing us to trace the processes of difference-making that lead to disparities. I look forward to being a part of the CCRR team and to making a difference in the health and well-being of people in the region. Thank you so much for allowing me to be a part of this great experience.
Thank you, everyone. It was wonderful to hear from all of you, and this indeed is an excellent team, and we look forward to the wonders all of you will be doing in the region and the nation overall. Now that we have heard from the co-directors, the associated directors, and the affiliated faculties, let's move on to some of the past mentees the team had mentored and see what they gained from the team's mentorship and where they are in their careers now. So let me share my screen.
My name is Ifeoma Zodiego. I am a postdoctoral fellow with Northwestern University. I lead dynamical modeling to inform the development of national malaria strategic plans in Nigeria. Professor Mahmoud's mentorship has been incredible and useful for my career. During my dissertation, he provided me with valuable feedback and also was instrumental in me winning a Rotary International grant. All of these was what ultimately led me to publish papers that resulted in my role.
Hi, I'm Pooja Subedi. I am a doctoral candidate and an American Heart Association pre-doctoral fellow at the University of Florida. My dissertation is focused on genetics of telomere length and how that affects our risk of cardiovascular diseases. My work with Dr. Mahmoudou and the cardiovascular disease research group at ETSU really helped me deepen my interest in cardiovascular diseases and help me build skills related to team building, teamwork, and collaboration across disciplines. I believe that the experience with the group was really crucial for me to be where I am today, and I am very appreciative of all the opportunities that was provided to me while working with the group.
Hello, my name is Daniel Rusu. I'm currently an academic intelligence service officer at the Centers for Disease Control and Prevention. I was a mentee at the Center for Cardiovascular Research, ETSU. And I must say that when I was there, I received great mentoring and tremendous support for my work. Through that work, I published numerous scientific papers, and it also helped me to develop research skills. So when I went to Georgia State University as a doctoral research fellow, it was very smooth transition for me. And I'm also applying the same skills in the current work I do as an EIS officer. I'm so grateful to all the mentors at the center, and I say God bless you. Thank you.
Hi, this is Holden Guy, ETSU class of 2019. I'm really excited to hear that there's going to be a new center for cardiovascular risks research at ETSU. When I was an undergraduate, I was involved in the tobacco policy research program in the College of Public Health, working with a lot of great faculty there, especially Dr. Hadi Mahmoudou. It was really beneficial on my undergraduate experience and my education. I got to do real research, applying for grants, writing, conducting focus group meetings, and got some of our results published in scholarly journals. That's been really helpful for me now because right now I'm applying to law schools and trying to decide where I want to go. But I don't doubt that I wouldn't have had as much success as an undergraduate had it not been for being involved in that program. I'm really excited to see what this new center is going to do. I'm sure they're going to be very busy trying to tackle some of the health challenges in our region and the solutions to them. I really look forward to seeing the good work that they do.
Hello everyone, I'm Yang Chen, currently working at CDC for chronic viral disease. Working as research assistant with Dr. Mahmoudou was my first opportunity at ETSU. It opened the gate of public health research for me to explore the new world. I got a chance to involve in research project for cardiovascular disease in depth and cooperated with multidisciplinary professionals. This great experience built a foundation of research for me and brought me working further on my career path for public health research.
Hello everyone, my name is David Kyoko. I'm currently a PhD candidate at the University of Wisconsin-Milwaukee. I graduated from ETSU back in 2014 from the College of Public Health. During this period, I also worked with Dr. Mahmoudou and other faculty in the tobacco research program. Through their mentorship, I gained experience in both individual and collaborative research. I was also exposed to networking through presentation at regional and national forums such as the APHA. Today, I'm happy to hear that you are launching the Center for Cardiovascular Risk Research, and I wish you all the best in the launch. Thank you.
Hi, I'm Crystal Bessie, 2016 graduate from ATSU's College of Public Health. I'm currently the Farm to School Program Director for the state of Louisiana. I coordinate the efforts of many in the food system spectrum to connect local farms with schools through school meals, school gardens, and nutrition education. The experiences that I gained while getting my master's degree were invaluable to my job today, including the collaborative research that we did with an interdisciplinary team of researchers and practitioners, and then sharing our findings to a variety of disciplines and audiences. Although I'm a transplant, the seeds sown during my time at ETSU have helped me grow and thrive in new opportunities that promote the public's health.
Hi, I'm Camry, and I'm a former student and graduate assistant of Dr. Mahmoudou. Dr. Mahmoudou was a great mentor for me in my time at ETSU, and he gave me the opportunity to participate in research projects that really changed the way I thought about population health. He's also the first person who ever gave me the idea to go on for my doctoral degree. And as a first generation college student, that wasn't something I was considering for myself. And so with the recommendation and experience that Dr. Mahmoudou gave me, I was able to go on and complete my doctoral work. And at this time, I am a regulatory specialist at Johnson & Johnson.
Wow, those were all very remarkable experiences and remarkable comments. And I can confidently say that everyone in the team and every one of us present here are very proud of them, and we wish them good luck for all their future endeavors. Moving on. So here are some current mentees that Dr. Mahmoudou and the team mentors. So as you can see here, we are a diverse group of students from undergraduate, graduate, and doctoral levels. And when I say this, I speak on behalf of everyone that the team's mentorship has been very valuable to us in terms of publications, grant writing experiences, and career advice. And as all our associate directors and the co-directors mentioned, we have had ample opportunities to work under their guidance. So big thank you from all of us to all of you for what you do, for your guidance, and for the trust that you put on us. Additionally, we'd also like to thank the center coordinators, Amy Poole and Cynthia Jan Blair, who, like Dr. Mahmoudou mentioned, has been working tirelessly to make the center a reality. So now, probably the most awaited moment of the event, the actual ribbon cutting and officially launching of the center by Dr. Bishop. So Dr. Bishop,
Well, I am delighted to have the opportunity to officially declare the center open by the cutting of the beautiful blue ribbon in front of me. Dr. Paul, Dr. Mahmoudou, I wish you were here with me to hold the scissors and cut the ribbon. You've done all the work for this, and now I get to do the ceremonial aspect of it. But congratulations. I look forward to the work that's going to be done. The work that has already been done is impressive. And I know that you are going to make this research center a success for our university and for our region. So congratulations. And are you ready? Drum roll. Here we go. Congratulations.
Thank you. Thank you, Dr. Bishop. Thank you.
Thank you.
So I think we are towards the end of the program. So Dr. Mahmoudou and Dr. Paul, do you have anything to say?
Okay. I think thank you very much for all our special guests, Dr. Bishop, Dr. Duncan, Dr. Wyckoff, and of course, Rob couldn't come here because of his work. And we also like to thank some of our special guests who are just attendees of this program, including my committee and others. And we apologize to those who received a wrong link and couldn't make it here. But we wouldn't be able to be here again without the initial support of Dr. Corey and Dr. Chakraborty alongside Dr. Duncan. And build upon that, today the center has been able to come this long way with the support of both Dr. Wyckoff from the College of Public Health, Dr. Bishop, who has been a staunch supporter of my research and the research of my collaborative group for quite a long time. And of course, Dr. Nolan, who wanted to be here badly, but has to go to another agent meeting. He made an original commitment to be here, but he couldn't make it. So we appreciate the holistic support that we've received throughout the years. And of course, I cannot end this one by also thanking our partnership with Valid Health that's make our research successful up to this point in time. So thank everybody for your time and for all the support that you have provided us for these years. So I will then hand over to Dr. Paul if he has anything further to say.
Thank you all. I echo Dr. Mahmoodou, and I want to especially thank again Dr. Chakraborty, Dr. Omal Kauri to give the suggestions and advice initially. And again, thanks to Dr. Wyckoff, Dr. Duncan, Dr. Bishop, and Dr. Nolan for supporting our center and approved by ETSU. Without everybody's help and without the leadership helps, we would not be able to launch the center today. Thank you all, and thanks for your continued support.
Thank you, Dr. Mahmoodou and Dr. Paul. And again, thank you everyone for being with us here today. So as you can see, the question and answer session is at 1:30 p.m. So if any one of you have any questions, you can use the same Zoom link to log in and we'll answer as much as we can.
Okay, so thank everybody for your time. Thank everybody for to the collaborators who were able to make it here and anybody who couldn't make it here. I appreciate everything. Thank you very much.